Bera. He chairs the House Subcommittee on Asia and the Pacific and will lead a congressional hearing into the coronavirus this afternoon. He is also a doctor and former chief medical officer for Sacramento County. Congressman, thank you for joining us this morning. I understand this new coronavirus patient is being tested in a hospital very close to your district. Do you know anything more about the situation?
Yeah, this hospital is in my home county, and I was actually faculty at UC Davis. So these are my colleagues caring for this individual. What's concerning is they thought or suspected he may have coronavirus last Wednesday and asked for testing. That testing didn't occur until Sunday, and that is a little bit worrisome. And, that's a question I'm going to ask in the hearing today, because we'll have the head of the CDC there. The problem is we may just be testing the tip of the iceberg, and we have no idea how big the bottom of the iceberg is, because we're not doing community-based testing, and that's something that we've got to think about and perhaps discuss.
Then what do you say when the president says, we've got this, we're ready?
I'd say that's overly optimistic. This is just the first case of community spread. We're going to see more. We've got great public health professionals. We've got great hospitals, but we've got to make sure they've got the resources and funding. I'm glad that the president's accepted the $8.5 billion. We may need more than that. And again, our first responsibility is to protect the public.
The director of the CDC is one of the witnesses at your hearing today. What's the biggest question you need answered?
I want to know, why it's taking so long to test folks. The fact that it is, we've got to get those test kits out to the hospitals and the health facilities that are on the front line. That's number one. I do think we ought to be doing community-based testing. That's just, as a public health expert like myself, we ought to find out the extent of this. And then number three, we've got to get our scientists into the hot zone in China. We've got a few folks there, but that's where we're going to get the best information and find out exactly how this is spread.
We heard earlier this week that the president himself was furious that CDC's public assessments of the threat caused the stock market to tank. Are you worried that politics here could interfere with getting people the most accurate information to stay safe about this virus?
Absolutely. Let's not worry about the stock market. Let's focus on the science. Let's focus on keeping the public safe. And let's do this in a nonpartisan way. Take politics out of this. And, we've got to let the scientists do their work.
Congressman, thank you so much for joining me this morning.